In this video, I'm going to show you how to use cupping therapy to help stimulate digestion. This is a really great video if you struggle with constipation, slow colon motility, SIBO, or just having very infrequent bowel movements. So let's say you're used to going every day and now you only go once every few days. So in this video, I'm going to show you again how to use cupping to help stimulate your colon. I like to use the silicone-based cups because they are more soft and squishy. They, I think, are easier to use, and I will link that below as well. And then I am just using a kind of like a body butter, but I highly recommend using Palmer's cocoa butter or a vitamin E oil as a lubricant or a moisturizer while you are doing the cupping. So the first thing you're going to do is you're going to take some of your moisturizer and you're just going to wipe, or not wipe, you're going to apply it on your abdomen just to moisturize it and lubricate it so that the cupping is much easier to do. Now I'm going to show you two different ways to do the cupping. So for the first technique, we're going to show you a static release. So what you're going to do is you're going to take your cups, you're going to squeeze them, and then you're going to place them along your colon. So your colon starts from your right hip bone, travels up into your rib cage, across the rib cage, and then down into your left pelvic bone. So I'm just using 4 cups right now. You can use anywhere between like 6 to 10 even, especially if they're small. But since I only have access to 4 right now, I'm just using 4. So when you're doing it, again, I like to squeeze it, pin it, and then squeeze it the opposite direction so it gets a good suction. Now it's going to feel like there's skin pulling or like some suctioning happening, and that's totally normal. If you hear gurgling, that's also very normal, which is a great sign that the digestion and your system is starting to move and get things going. So again, this is the first technique. Now with the static release, all you're doing again is putting it along the alignment of the colon, and you're just going to breathe in and out into the cups. So I want you to think about breathing in and out, breathing in 360 degrees into your abdomen, the side of your ribs, thinking about expanding your belly on the inhale. And on the exhale, you just let it go. So inhale again, and exhale. I'm going to do it for about a minute or two. Great, so that's static cupping. Cupping is a great tool for digestion because it's a suction, so it's lengthening, it's creating space, it's stimulating your circulation, your nervous system, all those things which need to function if you want to have good digestion. So just pull it off, you just squeeze the cups. All right, so that's static release. The next is a dynamic release. So dynamic is the same idea in which we are going to place the cups and move them along the direction of the colon. Now for this, you might need a little bit more lotion. So I'm just going to get a little bit more body butter and apply it on my abdomen. Now dynamic cupping is a little bit more tricky and it requires a little bit more skill, but you're going to take one of your cups, you're going to squeeze it, and then you're basically going to move the cup up and down. Oops. Now you're doing this along the direction of your colon. So I'm starting with my ascending colon first, about 10 times. Then I'm going to do my transverse colon and then my descending colon. So as you can see, the cup can kind of pop up and off, which happens if you don't have enough lotion or if you're pulling too far, like upwards. So again, trying to keep the cup more leveled and don't try to pull it up and down too hard. This again is a little bit more challenging, but just take your time. Totally fine if the cup comes up and off, as long as you're still doing the technique, it will be helpful. Okay, I need a little bit more lotion because it keeps coming off, which is why I like to use vitamin E oil, because that tends to maintain the oily surface a lot better. See, now that I put more lotion, it's a lot better. So again, you do about 10 times for ascending, transverse, and descending colon. And then I highly recommend doing this about twice a day. If you can't do it twice, even just like once a day is really great. And then see how it goes. So if you have any questions, feel free to let me know in the comments. I will again link below the Amazon link if you'd like to purchase these cups so that you can have them. Again, thank you so much for watching, and feel free to drop any comments below if you have any more specific videos that you'd like me to make.